Today, we're going to talk about coping with COVID-19 anxiety. How can we cope with COVID-19 anxiety more effectively? How can we help ourselves? And how can we help and reassure other people who are really worried? First of all, telling people not to worry isn't helpful. My clients have told me this many times over the years. Start with self-compassion and compassion for others. Give yourself and others a break. These are unusual times. Beating yourself up only makes that vicious cycle worse. We and others act instinctively out of fear. And people tend to revert to old behavior and bad habits when they're in a crisis. We need to interrupt this cycle. And we can only interrupt it if we're aware of it. We need to tune in and figure out what's happening in these connections between our thinking and feeling so that we can then make a change. We also need to practice acceptance. The threats of illness and confinement are very real. There's lots of evidence that this is a global crisis with few clear roadmaps as to what's going to happen next. So first we need to validate our concerns and the concerns of others with compassion and realism. Bill Howitt in the Globe and Mail on March 25, 2020 said, "It's important not to place blame, as there's no blame to place. This is a global health crisis that has no set of instructions. It's totally normal to feel isolated, worried, and not sure what to do." When I start to talk about acceptance, people ask me, are you saying to just agree with things or just say it's okay? There's some pretty bizarre paranoid ideas out there. For example, that COVID-19 is a Russian conspiracy or a Democrat hoax, or that you need to have 6 months of toilet paper in order to get through this. Acceptance as a coping strategy does not simply mean agreeing with somebody else or saying things are fine or okay. Acceptance comes from a lot of different therapeutic models. It originated in Buddhism. It's been used in CBT and also more recently in DBT, which stands for Dialectical Behaviour Therapy. When we talk about acceptance in therapeutic terms, we talk about the need to accept that things are uncertain. And with COVID-19, things are changing hour to hour. Life as we know it has been interrupted significantly. Acceptance is really about finding the middle ground between denial on the one end and negative exaggeration on the other. So if you picture a continuum where denial is everything's fine, everything's perfect, and the other end is this is a catastrophe, we're all going to die, we want to find a way to move away from the negative, slightly towards the positive, and say, it is what it is for now. We can only do what we can do. It's about realistically admitting what is in our control and what is not in our control. So then the question arises, what actually is in our control in this disaster? How can people worry less and manage their anxiety better? Earlier I said that CBT does agree that upsetting stuff happens and that we need to find ways to cope with it. Within this model, the only things that are really in our control are our thoughts and our behavior. To start to cope more effectively, we need to slow down and focus on what is actually in our control. A fun way I've heard it recently is not my circus, not my monkeys. This is a way to remind ourselves to pay attention to what is in our control and to recognize that there are things we are not accountable or responsible for. What other people choose to do is not within our control, as well as global events. As I earlier referenced Bill Howlett's Globe and Mail article, he says, the alternative is for your emotional brain to take over, creating negative emotions and thoughts, as well as reacting in ways that can put yourself and others at risk. This is again March 25th, 2020. Focusing your brain and time and attention on what is in your control sends a different signal to your brain. It takes your body then off the high alert, turns off that red danger light, and allows you to relax. This is that rest and digest reaction I mentioned. The way that we react when things are stable and predictable. We can interrupt the anxious cycle of fear, helplessness, and avoidance by changing what we think and or changing what we do in order to cope more effectively and feel better.